Chapter 15, Pharmacy Operations Management and Workflow. So we have our terms and definitions in the beginning of the chapter. We'll cover them throughout the chapter. It takes a team working together to keep a pharmacy and healthcare organization running smoothly and efficiently. The layout, equipment, placement, arrangement, responsibilities of team members, and standard operating procedures all factor into the way a pharmacy operates. Changes in roles for both the pharmacists and technicians are changing the way a pharmacy manages daily tasks and patient care. The knowledge requirements for technicians is increasing, and with that comes additional leadership, advanced opportunities, and legal responsibilities. To meet the demands of a patient's overall wellness, today's pharmacy technicians must understand not just their place in the pharmacy, but also in the overall healthcare system. The healthcare team members must work together to deliver the highest standard of efficiency and patient safety. Each pharmacy setting has specific tasks, and technicians provide distributive functions and supportive clinical roles. With the role of pharmacists becoming more clinical, this requires more pharmacists to be available for direct patient interaction and counseling. So, this leaves more of the daily activities to the technician, and workflow practices, organization, and knowledge are key to providing the best and safe services for the patient. The American Society of Health System Pharmacists, ASHP, Pharmacy Practice Model Initiative has a significant focus of advancing the health and well-beings of patients. It maintains optimizing the role of technicians is critical to this goal. Technician education, regulation, and basic knowledge levels are key to providing safe patient care and efficiency and providing those services required to keep up with the increasing complexity of healthcare and declining reimbursement. Pharmacists and technicians must work together as a well organized team and integrate pharmacy, wellness, and disease prevention services within the other healthcare providers. The ASHP and Pharmacy Technician Certification Board held a joint meeting in February of 2018. The future of the pharmacy technician profession, an emphasis on leadership, advanced or specialty roles, and requirements to practice were discussed. Efficiency and quality not only depend on a person's knowledge base, but also the actual layout and space of a practice setting. The state boards of pharmacy require physical standards such as a sink with hot and cold running water, appropriate lighting, and minimum amounts of space. In community settings, there are common areas such as the following: an automated long term care equipment area, compounding area, counseling area room, counter space for inventory checking and processing, data entry and or filling stations, drive-through window, durable and non-durable equipment, front counter, office for billing or physician calls, reconstitution area, stock, and storefront. The layout should incorporate a design that provides the most efficient use of workspace and allows workflow to run smoothly. For instance, the technician assigned to the front counter or the storefront area should not be the same person assigned to handle all of the incoming phone calls. Customer focus should be priority for the phone person, and distractions can lead to confusion and possible errors. Other duties for this technician may include drive-through window, overflow of calls to assist staff working on processing orders, or delivery drivers and mail. The placement of equipment and use of space in the front counter area are important. The computer screen should always be directed away from the customer, and all phone calls should be screened. Technician working in this area should be able to reach the pickup or ready prescriptions and drop off area within a few steps. This is also a last opportunity to check for accuracy of prescriptions and verify patient information. When working directly with a customer, use good nonverbal and verbal communication to provide quality care. Checking a birthday or spelling of a name can prevent an error at the time of drop off. When dropping a prescription off for filling, the technician must ensure the correct patient demographic information, such as address, birthday, and any payment or insurance information is readily available to avoid delays or additional work. If there are notes or messages from phone contact, illegible writing, that can also cause an error if the technician does not take the time to write correctly and provide the note appropriately. The data entry and stock areas are usually together to increase efficiency. A shelving section may be designated as fast movers and contains medications that are most frequently prescribed. This allows less walking or movement when preparing medications from the data entry to the filling process. If automation is involved, the machine may include these fast movers as part of their inventory. The choice of medication can be adjusted at different times of the year, such as flu or allergy season. It must be organized and kept clean at all times. Phone calls from third-party vendors, customers, and physicians should be handled with utmost privacy in these areas. Conversations should never be overheard by customers in the store or at the front counter. Fixtures should include a counter with computers for data entry and possibly one designated for ordering refill requests, drug lookup, or physician calls. Technicians should be assigned to different roles within this area, such as the following: bagging finished prescriptions, bulk medications ready to be returned to the shelf, counting or pouring medications, insurance rejects or refill requests, new prescription data entry, and physician calls or questions. This area may include scanning technology that also connects with the automated counter if being used. Automation can be found in most community settings and is an integral part of distribution. The filling and data entry areas may have the machine within it, and inventory is maintained as items are depleted and at the end of the day. Technicians often manage this equipment and they are assigned to just this task of keeping the inventory replenished. In a busy pharmacy, there's a constant need to restock these canisters and monitor the counting machines. The flow of this area must work well, and all personnel should understand each role. Beginning with data entry, the process must be organized and allow for interruptions to the process, such as insufficient inventory or problems that require a physician call. For instance, there should be waiting bins or a filling system to identify prescriptions that require additional attention. Workflow interruptions should not stop the pharmacy from performing the required daily tasks for other customers. There should be a designated pharmacist checking the area to provide a clean and organized way to check final products. It should be close to the bagging area and verification and counseling windows to increase efficiency. Finished products should be bagged and maintained in a pickup or will call area that is accessible to the front counter and drive-through window. To better understand pharmacy workflow and the technician's role in day-to-day activities, case studies are provided and explored in this chapter. I definitely recommend reading them. Workflow management in the institutional setting varies because of the associated daily activities and critical tasks. The main department itself is generally located in the central hospital with satellites located in areas such as the critical care unit, operating room, or recovery, the emergency department, and the neonatal nursery. These satellite pharmacies will usually have their own technician and pharmacists who work in the area directly with the healthcare team. Hospital pharmacies also may have an outpatient department where daily operations perform as a community pharmacy. In addition, there may be specialty chemotherapy pharmacy where technicians prepare sterile cancer drugs. The main dispensing pharmacy will be separated into areas such as the following. So they're going to have an automated dispensing system area, a CPOE area with order entry area, emergency or disaster medication supply room, filling area with pickup window and pneumatic tube, inventory area and storeroom, intravenous room, opioids area, OR tray and crash cart restocking, repackaging area, stocking area for non-clinical area for other departments such as central supply or EMS. The layout of a hospital pharmacy usually consists of a large room divided by counters or partitions with some offices included. The CPOE area is a bank of desks that should be located in a quiet zone where data entry and phone calls between pharmacists and other healthcare workers, either inside or outside the facility, can occur with minimum interruptions. This is where orders are scanned or faxed to the pharmacy and processed for filling or supply in an ADC. If you order for medication that needs to be in an ADC on the floor, the technicians in the automated dispensing area will perform the next step in the workflow. Each medication that is kept in the ADC must be individually packaged, and if stock is insufficient on the floor, a technician must deliver it to the cabinet. Medications are entered from orders sent from the floor. Once a label has been printed, the technician chooses the stock, counts out the medication, and packages the medication in unit doses. If the medication has to be repackaged from bulk stock, the technician may work with another area to get this accomplished. Deliveries are done continually and in batches that are set up by the department. The hospital maintains a formulary of stocked items in the cabinets, and if the drug ordered is a specialty medication or not appropriate for filling a pocket, a different process is followed. The automated dispensing area should be open, well lit, and close to the stock shelves and the CPOE area to allow for less motion for filling and questions if required. Communication may include that needs to go up to CCU now. The ADC is out and it's a stat dose. There are several technicians and possibly multiple pharmacists dedicated to this area because batch deliveries and one at a time orders are constant throughout the 24-hour period. The other similar area may be located within or near this area in the window pickup or pneumatic tube area. Once an order is entered into the CPOE area, if the medication is not appropriate for the stock of a cabinet, a label will print, and technicians in this area will fill the order manually. The shelves with stock may be in a square layout or in a cabinet form with bins. Medications are single or unit dose and set out for final check before delivery or pickup. This area should be small and compact so that the personnel save motion from the printer to the shelves and close to the CPO area for questions or special instructions. For instance, the nurse is on the way to pick that up or send it in the pneumatic tube its staff. As a technician, you must coordinate with other departments such as IV or the narcotics area. Medications may be ordered that have to be prepared simultaneously with you filling an order or restocking for an ACD. If a medication you are working on needs to be delivered, you may need to check with another department to ensure all components can be taken at the same time. This area may have its own pharmacist dedicated to verification of orders being picked up or tubed, and technicians for processing and quick deliveries. When proper workflow and management are put into place, a pharmacy can provide high quality and safe patient care while minimizing time and expenses. Layout of facilities, use of educated and trained technicians, and standards of practice established provide a solid foundation for success. Any breakdown in the system or workflow can start to snowball, and the pharmacy process can begin to break down. In addition, if workflow is interrupted constantly or there is a lack of attention to process, errors can occur. Getting a baseline or a starting point is key and is the first step in creating a quality assurance process. Identifying a problem and its cause will then lead to ways to improve or change a process if needed. Unless all the components of why an error occurred are known, unnecessary decisions may be made and the problem may remain uncorrected. Quality control is taking those established plans and discussions and making them into activities that prevent an error or make a process better. And here's some ideas for the community setting. to improve the department's quality and workflow. So I definitely recommend reading through those. And then also the same for institutional settings. I'll let you guys read that. And then just make sure you remember these key points.